Now, even though much is being done to combat cervical cancer, once diagnosed with cervical cancer, many imagine for the worst. According to statistics here in Kenya, 9 women die daily from cervical cancer. Now, on this episode of Health Nuggets, today we bring you a story of hope and resilience of one Sally Kwenda, who was diagnosed with cervical cancer in the year 2007. Sally, karibu sana, and thank you so much for your time.
Thank you so much for this opportunity. My name is Sally Kwenda. I like talking about my age. I know women don't like,
Of course.
But what I've gone through in my life makes me feel motivated that I'm alive even today. So in this year, 2023, I'll be turning 54 years old. A lot of women don't want to say their age, but I proudly do because I've gone so much in life, and because of that, I've become a patient advocate. Growing up, I wanted to be a doctor, but me and mathematics were not friends. So, but anyway, now that I'm in the health space, people call me Daktari, and I'm glad that I can help.
Sure.
Yes.
And now today, let us just talk over your journey. Before definitely the cameras were turned on, you just told me of your story being a story of hope and definitely a story of resilience. So just let us know, when were you diagnosed with cervical cancer and how the journey has been? And before probably you share about your journey, when the doctor told you that you had cervical cancer, what went through in your mind?
So maybe I'll start a little, not with cervical cancer, because cervical cancer came later. I got a baby almost immediately after marriage, but the baby died after 2 months. We were living in Mombasa with my husband, so there was that pressure of bring the baby to Nairobi. We are all here and you are alone there, you come. So when the baby died, a few days after I was in Nairobi, I thought maybe it's, the change of climate, the weather and all this, because you cannot compare Mombasa and Nairobi. And I thought, okay, and I was really bitter with God, like, how do you just show me and take it away? But anyway, God had his own plan. So I got pregnant almost immediately. But during this pregnancy, I had a lot of complications. I was falling sick on and off, in and out of hospital for different reasons, and especially pneumonia most of the times. So when the pregnancy was at 7 months, I got a miscarriage. But the baby was still alive. A baby boy, of course. My firstborn was also a baby boy, and the second one was a baby boy as well. So I was put in the incubator, but after 3 days, he also died. And that is when now things started happening. My husband changed. He was not the one I met when he was saying, I want you as a wife. So he got his behavior changed, and he was not the man that I thought loved me. And I got very sick now. So one of these days I was admitted in hospital, and then I was told, come for your results after 1 week. So I go into this room, and the medical person who was sitting there looked at me and said, unaitwa nani? In Mombasa, of course, people speak Swahili, yeah. And I gave her my name, and she said, we uko na ukimwi. Blankly like that, we uko na ukimwi, without counseling, without nothing. And those days, that was in 1999, the results were given in a brown envelope. Yeah. So, and for me, AIDS meant death. Yeah. So I looked at that brown envelope and I thought, okay, this person is giving me my burial permit. So the next thing is to go and look for mourners and set my burial and go. So I was shocked, like, that is not what I was expecting. And she looked at me, so I started crying, and I was lying on that table, and she told me, did you see the queue that was out there? Kindly allow me to serve other people as well. It was that harsh. So I left the room, carried my burial permit, and walked away. I was so confused, I was numb, I was in a state that I cannot even describe. So I walked home, and then my husband comes back, sweetheart, how was it at the hospital? How was the result? So the same way, the person told me uko na ukimwi, also threw the envelope on the table and said niko na ukimwi. And he looked at it, looked at me, and he happened to be a member of this Members' Day that people say. I don't know what happens on Members' Day, but he just went to the bathroom, changed, and left. So that was routine. It became routine. Now he could go, come back on Monday, change, go like that. So after 2 months, I went into deep depression. And I thought, why should I even be alive? And as we say, the devil is real. And the idle mind is a devil's worship, is a devil's workshop. So I'm here and I'm thinking, my children are gone. And the devil is telling me, follow them. Yeah. What are you waiting for? Follow them, follow them. And my husband is treating me like a stranger, like he doesn't want to be with me. He's not talking to me. And I said, what am I waiting for? And I was telling him, I'll kill myself. And he didn't bother. But one day, before he left, I told him, I've been telling you I'll kill myself. But today I will for sure do it. And looked at me and said, oh, okay. You know, in Kenya, anybody above 18 years is free to do what they want. Go ahead, do it. And that was like now a rubber stamp on my burial permit. Say, I already have my burial permit. So this was like a rubber stamp on the burial permit. And after he left, you know, in the house, you always throw coins somewhere. So I looked for, that time there were no mobile phones, and even if they were very expensive, so not many people had them. I also didn't have one. So I just got some coins in the house. I wrote a letter to my sister, who was like a mother to me, and said, please don't look for me, because you will not find me. So I started, in my mind, I was already planning for my death, even from the 2 months ago when I was tested for HIV. So I was already planning for my burial. So I thought, should I go to the highway and jump on the road? A trailer hits me. I said, maybe I'll just get a fracture and then I'll be in a wheelchair for the rest of my life. And I thought that will not work. I said, should I take some rat poison? I said, maybe I'll be given some milk or eggs and then I vomit and it will not happen. And then I remembered I have phobia for water. So I decided that the ocean will be my burial site. I wrote the suicide note. I got to the post office with the coins that I had, bought a stamp, put it in the letter, and posted. So I walked to the Likoni ferry. And I boarded the ferry. And in the middle of the ocean, I dived into the water. I'm a non-swimmer. The only water I can bear is a glass of water or in a basin to shower. Nothing more than that. So I'm here in water. In my stupid mind, I thought when I dive, I will drown. But I was just floating. And I thought, I was now fighting with the water to swallow me. So I was trying to push the water to go into my mouth, but that was not happening. And I don't know if that is what death is, because at some point I felt some peace. You see the way you can hold a baby like this on your laps and they sleep? That's the peace I got when I was in that water, in the ocean.
Was there anyone like trying to save you, or?
But by that time, the divers had come. So I was safe. So the divers had come and they had overpowered me and they were already swimming back with me back to the ferry. So I wanted it to look natural. So what happened when I was taken back to the ferry, I just lie there. But I was very sober, like my mind was clear. So people were coming, some are stepping on me like, ni binadamu kweli, or to confirm, is this a human being? How can she do such a thing? And what was also not making sense to a lot of people, even the doctor who saw me when I was taken to the hospital for first aid, it's like I was only wet on this front part of my body because I was lying on the water trying to drown myself. But the back of my body was dry. In Mombasa it's hot, so I was wearing open shoes and they were still on my feet. Can you imagine? That was amazing. That was a miracle, actually. And I say there are miracles and God is there and He performs miracles. And for me, that is now where I got my true or real salvation. That is when I encountered God and I had that experience that, yes, there is a God.
So did you go back home, and at that point you just mentioned that now you were told that you are HIV positive. Was your husband also tested for the same?
So when I went to the house and shared the news with my husband, he was coming home and going. He never went for the test. And he didn't want to hear. And he said, you know where you got that from. And as I'm telling you, we were not in talking terms. Like, yeah, we were nil by mouth. So, but after I was rescued from the ocean, I woke up from the hospital and told them, like, let me tell you why whatever happened. So my husband was called. I gave them his office phone number. He was called. He came and he was asking, do you know why this woman is here? Yeah, this is my wife. And did she try to commit suicide? And they were like, what? You actually know that she wanted to commit suicide and you never reported. You know that is an offense. But anyway, I was supposed to be arrested because, you know, suicide is attempted murder and no one is allowed to take away their lives. So I was called, a psychiatrist was called, and he examined me and said, this woman is just depressed and let us give her a chance. So during this time, HIV was like corona now. Like, doctors didn't know what to do, what is the medication, what are the symptoms, what is what. People didn't know how to handle people who have HIV. Actually, it was AIDS because there was no treatment. Yeah. So the only place that people were being taken was Bagadi Hospital. And that was time it was called Infectious Diseases Hospital, IDH. And my sister was really struggling to take me there every day, but there was nothing. There was only one drug that people were being given, and it was called Septrin. And for me, I have allergy for sulfur, so I couldn't take it. Yeah. And I watched people die in Bagadi Hospital. People were dying. And I was asking God, you said I go and save your people. Everyone is dying around me. I'm looking at myself and I'm getting weaker and weaker every day.
You're in a similar situation.
Yeah. We are sailing in the same boat with these people. So what will make me live? But he still gave me that hope, like, I want you to go and save my people. But I was saying, I can't, I'm weak. But somehow, my strength, miraculously, I started gaining strength. And then in 2003, my sister is also a widow and she was really struggling. But she started buying for me the antiretrovirals. They were very expensive, but she could buy once in a while. If she doesn't have money, we don't get. They're quite expensive. Like, I can remember a week's dose was going for 6,000 or something like that. And during, in 1999, 6,000 was a lot of money. So she could buy, sometimes she doesn't have the money, and yeah. So in 2007, as usual, we went for the checkup. And this time, it was, they said, especially now that I had HIV, we were encouraged to do cervical cancer screening and also targeting the human papilloma virus because of the compromised immune system. So we were all the ladies, we went, we were screened, and all that was done.
So was this the first time that you were probably being screened of cervical cancer?
Yes. Okay. Yes. So I got screened, and after about a few days, 3 or 4 days, I got a phone call that, Sally, please, we need you to come back to the hospital. And I was like, why? Are we all coming? No, it's just you. And some fear set in me, like, why am I being called back? Okay, I didn't think about anything, but I just got some kind of fear, like, could something be wrong? And what is it? But anyway, I went to the hospital, and again, the results were given to me in a very harsh way. In the same way that they told me that uko na ukimwi. This time the doctor told me, we have we checked you for human papilloma virus, and because you had a history of HIV, we went further and did other tests because they had actually taken, they had also done pap smear. So because they had seen some abnormalities, they had taken samples. So they had gone through all that process and did all the screenings. And they said, you actually have cervical cancer stage 2. And I imagined, I've already lost my children. And this doctor is telling me, you know what, we have to do what is called total hysterectomy. to remove your womb, your uterus and everything, because you have HIV. This will spread. Because now you have cancer, this will spread. And I'm telling Daktari, I lost my children. If you're telling me that you want to take away my womb, it means that I cannot have children. And he said that you have to make a decision so that we save your life. That decision was not easy for me to make.
Now, before that, were you probably experiencing any signs of cervical cancer before you were diagnosed with it?
I wasn't, because it was just a routine. Like I told you in the office, it was just routine checkup. So like any other year, it was just routine. So I wasn't expecting anything. I wasn't feeling anything at all. I did not have nothing. We had to start intervention immediately because of my compromised immune system from HIV. Because I'm positive for the human papilloma virus. And because of the samples that were taken from the biopsy, it shows that I have cancerous cells, but they're only in stage 2. So to do this radical hysterectomy, that surgery, to remove all that, then all that junk, I'll be okay. So my employer allowed me to take a second opinion, a third opinion, until I was satisfied. So for 2 months, I was confirming if this is what the first doctor told me. And my colleague sat with me and said, Sally, it is very traumatizing, it's not nice, but just go for it. And my husband was also very supportive, surprisingly, at this point, and he said, don't worry, we can adopt a child, don't worry. As long as you are alive, it's okay, let's just do it. So after 2 months, because it was a radical operation, we had to sign a consent with my husband to say that it is okay for this to happen. So we signed a consent and I went to theatre. So after going to theatre, a lady also we are married with in the same home came during visiting hours, and she was the first one to arrive. So I was just waking up from theatre, still drowsy from the anesthesia, and she tells me, Sally, I know you are in pain, I know it's not the right time, but I have to tell you this. You know, there are people, when they hear some news, they can't stay with it, they have to speak it out very fast. She told me, you know what happened? Your husband came and told us to have a family meeting. And in the family meeting, he told us that the doctor said you have cancer of the uterus. And you're going to have a radical operation to mean that you will not have children again. And he still feels he's young. He wants children. So we have to get for him another woman. Can you imagine? So this lady came to the hospital before my husband came. So my husband comes and asks, sweetheart, so-and-so is telling me this. And he confirmed and said, yeah, I'm still young. I can't live with a woman who can't give me children. I said, but I gave you children, but they died. He said, no, but you can't give me children. I said, we signed a consent with you. I said, I don't care, I'm sorry. So he left me. I struggled on my own. And this time, he went for good, because he wanted children. So he went and stopped his HIV treatment because he didn't want to disclose his status to any other person. Unfortunately, in 2012, he passed on. Yeah, may his soul rest in peace. He passed on because he stopped taking medication and he was all over the place trying to get a baby, which didn't happen. But anyway, I attended his burial, and as God was telling me, save my people. So everywhere I was going, I was creating awareness. Where I come from, Nyanza, and in our place, people don't just die. You are killed. So I told the mourners, please don't say this person was killed. He died a natural death. He was sick. He had HIV. I had HIV. I lived with him for 10 years, and I must say that this is what happened. They were so shocked. You know, in a funeral, people talk nice things. Yeah. So I talked both nice and bad. Yeah. And they were so shocked that I can say such a thing. But I said, yeah, this is it. Please, guys, go and get tested and get your medication. Because this is what he has left me with, and I'm living here. And I'm telling you, because God has sent me, I'm on a mission. Please, I'm telling you, go and get screened for HIV and whatever. So I was now being followed very, very closely. So the doctor, the oncologist who was treating me for cervical cancer told me, because you have HIV, we cannot do chemotherapy and radiotherapy. Cancer has other types of treatment, so we can do surgery, and since it is only on stage 2, you will be fine. So for me, the treatment for my cancer has been surgery all along. And all the procedures were done in theater, so many. So I went to theater so many times until, I think after 13, I lost count. Like every time I went to the hospital, it was theater, 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 for major, for minor.
All right, now I think we'll just leave it at that for now. We'll be taking a very short break, and we'll just come back with more. That is from Sally Kwenda. As you've heard, she was diagnosed with cervical cancer in the year 2007, even as we continue creating awareness right here on Health Nuggets about cervical cancer. So we take a very short break. We'll come back and now with more so on awareness creation.